Welcome everyone to the CT Nurse Wellness Project Live. I am here with Rebecca, who is a CT nurse. So excited to have you, Rebecca. For those of you who don't know me, my name is Dr. Wendy Garvin Mayo. I am an oncology nurse practitioner here in Connecticut. I'm also the founder of the CT Nurse Wellness Project and the co-founder and visionary for the CT Nurse Wellness Summit. You'll see a new brand there, Winwell. That's a founded brand. We'll talk about that another day. But I want to get to Rebecca. Thank you so much for being here.
Thanks for having me.
Yeah. Why don't you introduce yourself? Tell us who you are and a little bit about your nursing background.
So how I know Wendy is because I went to the Nursing Summit. It was great. I had the opportunity to go, sponsored by my school. I am in grad school right now to become a psych nurse practitioner. I currently work as an outpatient mental health nurse, and on the side, I'm in the hospital still on an inpatient psychiatric floor and in the acute behavioral unit in the ED. Before that, I did ER nursing, endoscopy nursing. That's really the bulk of it. And I did EMS prior to nursing. And nursing was actually a second degree for me. My first degree was actually in health sciences with a focus in nutrition. So, wellness is something that's been a big focus of mine for a long time now. So
awesome.
Very happy to be here.
Yeah, so you're like a typical nurse with more than one job, been doing all the things, right? That's how we operate. I haven't met one nurse who's been like, I've been here for 30 years doing
and only here, nowhere else. No side jobs.
Yeah, so Rebecca, just in your journey as a nurse, being in the ED, endoscopy, and now in psych, and even EMS, what has been the most stressful position you've had?
Oh my goodness. That has to be the ER. I went into ER nursing as a new grad, thinking it would be a relatively easy transition for me because, again, I did EMS. I was an ER tech during my first degray. And it was in this, because switching from EMS brain to nursing brain is a transition. So, I stayed in an environment that I knew. But I mean, the pressure that was on us, at least at the hospital where I went to a level 1 trauma center. And I mean, the assignments that we would have were crazy. And just, the hardest part for me is knowing the quality of care that someone should be getting, knowing what should be happening for someone, and knowing that I am incapable of meeting that need right now, because it is simply impossible to provide that level of care when you're having, 7 super acute patients, for example. So that was by far the most stressful part for me, just because that weighed on me so much outside of work.
Yeah. And that's very interesting. And that's why I do what I do, because, nurse wellness, when we say nurse wellness, we think of occupational workplace stress. But the reason I do it is because it's about you as an individual, you at work, you at home, you with your husband, your family, your children, or individuals with their wives. But it's really about you. How do we make you well so you can show up as a nurse and just as a person, life the way you want to be seen. So right. I think that's very interesting. Thinking back to nursing school, now I was just talking about this today in my community about our nurses groomed to be stressed. I would love to get your opinion on that.
Yes. It's funny. I think I saw something about you posting something about that, and I didn't read it yet, but I was like, heck yeah. No, I mean, I try to not think about nursing school too much, to be honest with you, so I'm part of that. But no, I definitely think they groom you to be stressed. And it's funny. The first thing that comes to mind when you ask me that question is they teach you in nursing school to be an advocate, right? And to speak up for people. But I remember when I tried to speak up on behalf of my class for things that were happening that were not right. I finished school at the very beginning of COVID. So we had to deal with that whole transition from, traditional learning to an online format. And, there was a lot of stress, but, some things were not handled, we felt, appropriately. And I remember trying to speak up on that. And I mean, being effectively silenced, I can't remember verbatim what was said to me at this point, because again, I think I just moved on. But, I remember thinking, and I said this to someone in the administration, I'm like, you're teaching us to advocate, and I'm advocating. and you're telling me now that I'm wrong for advocating. But this is what nurses are. We are supposed to be advocates. So we are advocating for ourselves and, you know, being shot down on that. So it was a very eye-opening experience that, you know, okay, so we can advocate for other people, but our needs don't matter.
Yeah.
That felt like
how did that impact your role as a nurse, or even now? Because even you talking about it, I feel the passion of you even recalling that situation. But how has look at you? Yes, look at you.
You talked it out. I forgot about it until like just now. But yeah.
Yeah. How has it impacted you?
I mean, I think I've always felt strongly about still being able to advocate for myself and for my peers and for what's right. And again, that's why that first nursing job was so hard for me, because you know, things that were happening weren't right, and I didn't really have you know, I spoke up where I could, but there was only so much I could do. It was a bigger problem that I was in a place to change from the position I was in, you know,
right?
And I had to go somewhere that was more in alignment. But yeah, I mean, then, you know, that one issue I might not have necessarily won on, right? But it definitely did not squander that side of me, you know, where I'm still going to advocate for, you know, what we need. I'm currently debating becoming a union rep. I'm not sure on that yet. It's a big move, and I have a lot of other stuff on my plate, as we discussed. I don't know if I'm ready to add another thing, but you know, that's something that's very important to me, and that definitely has not gone anywhere. So
yeah, I love that. And that's it, because as nurses, it's not about us. It's really about the bigger vision, the other people, the profession, the individuals we serve. That's what it has to be about. But that situation that you had could have really taunted another nurse who maybe didn't have your mindset, right? Maybe I just won't advocate for myself because people will not listen to me, you know? So that's very important. So we always say self-advocacy, but then if you feel like leadership's not hearing you or they're not receptive to that, that may shut you down from even trying again.
Right.
So did you have any classes or courses on wellness, stress management, self-care in undergrad?
No, not that I can think of. Not in undergrad. There is a class though that we just actually had in grad school. Oh man, what semester was it? It's already all blurring together. But we did have something that was somewhat, it wasn't entirely geared towards that, but it was focused on kind of, as a professional as a whole, what things do you need to do to feed that? So including, you know, professional development, but also self-development, spirituality, things like that. And that was I really enjoyed that class. And I do wish that we had something like that in undergraduate. You know, I think I had a lot of personal focus in that arena, but that's not, I know I was not necessarily the norm.
Yeah. In retrospect, what do you think, what benefit would that have if you had maybe a class on stress management or wellness or self-care? Do you think would it have made a difference in your career?
I think there's a chance that I would have put a little more effort into being more well-rounded, honestly, a little earlier on. You know, I think in my early career, both in EMS and nursing, I focused a lot on work and not so much a lot on, you know, professional development, sure, is insofar as career development, continuing education, things like that, but not so much in developing myself as a person. And that's something that, you know, the last few years I've been doing a lot more of, but that's not something that I, you know, my partner and I keep joking that we're overcompensating for the lack of, you know, things like that we did in our 20s.
Yeah.
So, you know, we're trying to cram it all in now. But yeah, you know, just having that well-roundedness is so important, and not just being so focused on just work.
Yeah, it's so important. Like, even for me personally, you know, the 4 years of nursing undergrad was probably the most stressful years of my life. And I felt like launching back out into, you know, the workforce, going back to my master's, all that. You're in this mindset where you just go, do.
Yeah.
And not until something happens. Like for me, it was the pandemic that really like, okay, let's reevaluate. But you don't really have the time to pause and reevaluate when you're what I call like in that cycle, in that stress cycle, or in that fight or flight. So you are groomed, you know, to my earlier question.
Yeah.
Stressed. And I know that you had me speak to your graduate student nurses association. Tell me, why was that important?
Just, I see it a lot with my peers that, again, like, we're not so much focused on ourselves. We're focused on the work and our patients, and, even sometimes in nursing as a whole, but again, not in ourselves. And like you said, we are groomed to do that. So, I think just having a little more focus on, taking care of ourselves so we don't burn out and we don't, end up unable to do the things that we love to do. That's important. And I especially in grad school, you got a lot of people, sorry, I'm trying to keep my dogs. Okay. You have a lot of people who are full-time or part-time students. They're also working full-time or part-time. A lot of them have families, have children. They have to go to sporting events. They have to go and do all these things for everyone else. And they don't get, they don't stop and think about themselves. And I think in nursing, we need more of that.
Yeah, no, absolutely. Absolutely. And what does wellness mean to you, Rebecca? How do you define wellness? I always say it's individualized. It's not like a one size fit all, but what does it mean to you?
You would think I would have a better answer, like, ready for this now. There's two things that come to mind, right? And one of them is balance, just, again, being more well-rounded and not just having everything be so tipped in one direction, like all work, all, whatever. But I think also, like I was saying before about how my first job didn't feel like it was in line with my values. Mm-hmm. I think living a life in line with your values is so, so important for wellness. So I know that's not the most direct answer, but I think those are the two biggest components that jump out to me when I think about
that. No, absolutely. Absolutely. I agree with you. And it's for people to know that and be able to communicate that and really honor that.
Yeah.
So I think that's important. And you said you were an attendee at the summit, which was really good. It was a half-day summit.
Yes.
So that was a really good day. Everyone felt really good, left feeling good, feeling relaxed. We got a lot of great data. Okay, go ahead. Yeah.
Just going to hold her for a second.
Yes. Now that's good.
This is Maddie.
Maddie.
Oh,
she's one to love. So the summit was really good. You left there feeling good. Now, since the summit, have you been implementing anything, doing anything differently?
More meditation for sure. The guided meditation that we did there was the best one I've ever partaken in. I think I fell asleep sitting up, actually. I wasn't even that tired. It was kind of crazy. So I definitely, that was the, like I said, best one I've done, the most like meditative state I've ever, I think, been able to get to while, again, not actually sleeping. So it really spurred a lot more interest in doing that more. I've tried in the past and I never really got very good at it, but
I love that. I love that
a little bit for me.
Awesome. And what were your thoughts on when you saw the launch of the CT Nurse Wellness Project being a statewide initiative to really honor nurse wellness across the state? What were your thoughts on that?
I think it's so needed. Again, we focus so much on everyone else and what we can do for our patients, for nursing, for the community. And we don't focus enough on our wellness. We can teach other people how to be well, and we don't follow, our own advice. It's like, we go in and we tell our patients not to smoke, and then, half your coworkers are taking smoke breaks, things like that. Like we don't take our own advice very well. And I think it's about time that we do. So it's very important and needed initiative.
Absolutely. And my last question for you is, if you had a magic wand, what would a statewide nurse wellness initiative look like? What would be success to you as a Connecticut nurse?
I think a community component would probably be the biggest thing. I think a lot of us really need some more like-minded people to do these activities with and to just connect with, and even sometimes just commiserate with. Yeah. And, I think even pre-COVID, this was an issue, but I think COVID really pushed it over the edge where people have really lost their community. And you also hear people more and more recognizing that and like yearning for it, I know I started going to a church recently, and their attendance has also, jumped up, and like book clubs, things like that. People need the community. So I think that would be a huge win if that
I love that
community option for people. Yeah.
I love that. And my very last question, what advice do you have to an undergrad who's watching this segment in terms of self-care?
Just to learn what your values are. Learn what your values are, become self-aware of them, and learn how you can incorporate them in your daily life. So you are living within your values and you are balanced.
Love it. Well, thank you so much, Rebecca. It was great.
Thank you for having me.
Absolutely.